Carolina in the Morning on Fox Wilmington.
We are back now this Thursday. Prostate cancer is still the most common cancer in men and the second leading cause of death for all cancers, from all cancers. In 2014, it's estimated that every 5 minutes, 2 men will be diagnosed with prostate cancer in the country. Unfortunately, prostate cancer will take the lives of some 30,000 of those men across the nation. Midway through the month of September, which is Prostate Cancer Awareness Month. And with us this morning, it's a reminder to make sure if cancer is detected, prostate cancer is very treatable. Early detection is the key. Britt Zimmerman, a urologist at the Zimmer Cancer Center at New Hanover Regional. Britt, thanks for coming in this morning.
Thank you very much.
You know, at one time, the most common form of trying to detect if a man has prostate cancer, the PSA test, had come under a little fire. Some say it was not that reliable. Is it still, though, the most common form of testing, the first round of testing when it comes to prostate cancer?
So when we look at diagnosis of prostate cancer, we take into a combination. PSA is still the most common blood test performed, but that also is common. That is also in conjunction with a rectal examination where we actually check and manually check the prostate. But we also add in the addition of family history and also counseling to men that may be concerned. There are groups, people that are of African American descent, as well as those that have family members within the first generation, such as brothers, fathers, uncles, that do increase your risk for prostate cancer.
At what age do you recommend now that a man get that first check for prostate cancer?
So according to the American Urologic Association, we start making the recommendation to check for prostate cancer between the ages of 50 and 55 if there is no increased risk. For those of African American descent, we then make the recommendation of screening as early as age 40. The reason we do this is because prostate cancer is a slow-growing cancer, and if we can catch it early, then we can have a greater outlook and change in their life.
Yeah, it is very treatable, but there are several options that are out there for someone that does get a positive test result back. There are several options they could choose from still, right?
That is correct. There is roughly between 3 to 4 options that we look for. The traditional removal of the prostate, also known as a prostatectomy, has been the mainstay for a number of years. With that, there's also radiation therapy, which can be delivered from the outside of a patient or within seeds implanted in the prostate. And then there's also much less invasive means, such as active surveillance, where we actually meet with the patient roughly 3 or 4 times a year, as well as repeating and drawing blood tests, such as the PSA, and doing the digital rectal examination. Or we also have what's called watchful waiting, where we actually only treat the patients if they manifest symptoms.
Okay, but men, you have to drop that fear of having this done because, again, as Dr. Zimmerman was saying, early detection is certainly the key to going into those treatments. Get it called early, have it treated, and hopefully things will work out well. Dr. Zimmerman, thanks for coming in this morning. We appreciate it.
Thank you.
Nice to have you here in Wilmington from Detroit, Michigan, right?